Again, we are doing case studies today. All right. Everything that we're doing is a case study. So we're going to start here. Case study number 1. I'm going to adjust the text on the screen here. Okay. All right. All right. The link, Bertha, the link is on my profile page. If you click my face up here in the top left corner, it'll take you to my profile page to where then you'll see a bolded link. It says beacons.ai. All right. Then that's the link to click. Okay. It'll take you to all the resources I have. All right. Can everybody see this? Here we go. Case study question number 1. Case study question number 1. This is a select all that apply. All right, already up over 200 people in the chat. Thank you, guys. All right, I'm seeing a bunch of A, C, and D and C and D. All right. So which findings are most concerning and require immediate attention? So this first question is A, C, and D. Okay, it's not B because clear lung sounds do not mean the patient's stable. Okay, sometimes when we're talking about a PE, they present with clear lung sounds because the problem is perfusion and blood flow, right? So not ventilation. So that option was a trap. Okay, so, and E, it's not E, all right? Temperature of 99.1 is not a priority. Okay, so that being said, we're talking about somebody with a PE. So let's go to question 2 of the case study. Okay, here we go. We kind of talked about it. Sorry, I got ahead of myself. All right. Right. So these questions are going to build on top of each other. That's what these case studies do. So that question 1 is about recognizing the cues. All right. Question 2 is about analyzing the cues so that you can make a diagnosis. All right. So yeah, the answer here is going to be B, pulmonary embolism. I think everybody got that. All right. If you're just tuning in, we are doing case study questions, all right? We're talking about a patient who now, question 2, we've determined they have a PE, all right? Each of these questions, there's 6 in case studies. They're gonna build on to each other, all right? So question 3, all right? What is the priority hypothesis the nurse should act on? What is the priority hypothesis the nurse should act on? Right, okay, A. So this is the dangerous, best fitting explanation of the PE and is leading to impaired gas exchange and oxygenation. All right. So if you're wondering what the priority hypothesis means, essentially it's what explains the entire picture and is the most deadly thing going on right now. All right. So good job. Question 4 here in this case study. Which interventions should be initiated first? Select all that apply. All right. All right. If you guys are just joining, we are doing case study questions. This is the 4th question in a 6-question case study. And so far, we're talking about a patient with a PE, a pulmonary embolism. So which interventions should be initiated first? Select all that apply. Select all that apply. All right. Lots of A, B, and C, A, B, C, and E. All right, so the correct answer on this one is going to be A, B, C, and D. All right, I think everybody had A for the most part. Looks like a lot of people kind of did or did not have E. All right, so E is correct because here the definitive diagnosis often involves imaging. All right, so we need that CT angio, and that timely preparation prevents delays in care. Okay, so that's why E is in there. Also, it looked like B was kind of missed a lot. So B is going to be correct because the suspected DVT or PE here, these types of patients should avoid ambulation initially in order to reduce the dislodging of the clot. Okay, so the answer here is A, B, C, and E. All right, it is not D, as ambulation is unsafe. All right, when DVT or PE is suspected. All right. All right, good job. Yes, this is a case study. All right, so these are case study questions. We are going to question 5 of 6. So bringing up the speed, our patient has a PE. We just elected some options for them to, some interventions to apply. All right, so that is the generate solutions part of the case study. And now question 5, we are taking action. That is the take action portion of the case study. All right. Good, guys. I think this one is, you guys feel like this one's pretty obvious, and I would agree. All right, so B, the answer is B here. Administer the heparin infusion per the protocol. All right, so here in the take action, this is where the NCLEX tests if you'll treat the problem or babysit the symptoms, okay? Anxiety meds are the trap here, okay? We don't sedate the hypoxic patient and then call it care, right? Okay, heparin is the action. All right, ECG is data. Fluids are irrelevant, okay? We need to stop the clot from growing. All right, great. So then the final question of this case study, all right, 1, 2, 3, 4, 5, 6. All right, so thank you for whoever just ordered a study plan. Well, fantastic. I don't see the name attached to that, but all right, so question 6, we need to evaluate the outcomes. So which reassessment finding best indicates the patient is improving? All right, which reassessment finding tells us that the patient is improving? All right, noon, awesome. Thank you for ordering. You know, I'd turn those around in 24 to 48 hours. All right, so yes, answer here is A, okay? So evaluate outcomes here it means, right, did the thing we are trying to fix actually improve? All right, our threat was oxygenation, so improved SpO2 and respiratory rate is what we want to see. All right. All right, good job. This was kind of a warm-up. All right, if you guys were tracking on that, then awesome. Good freaking job. All right, so if you guys haven't already, you can go ahead and follow as well. I do these lives for you guys every Sunday, Tuesday, and Thursday at 9 p.m. Eastern. Okay, this was the first one we've done with just case studies, so we'll do more of these. All right, so here we go. Case study number 2. All right, thank you guys for all the follows. All right. So question 1 here. All right, which findings require immediate attention? All right, select all that apply. All right, guys, we are applying the thinking and logic that goes into case studies on the NCLEX, okay? That is what we are doing here. understanding what each of the 6 questions is actually looking for. All right. All right. Okay, so the answer to question 1 of this case study is B, C, and D. All right, B, C, and D. All right, so B because we're talking about severe metabolic acidosis, and that's life-threatening, right? C because hyperkalemia increases the risk for lethal dysrhythmias. All right, and D because Kussmaul respirations indicate that there's some respiratory compensation for the acidosis going on. All right. High glucose is expected in DKA, and it is not the immediate killer. So that's why not A. All right. E, oxygenation is currently adequate. So here it's pretty common for students to lock in on glucose, right? Because it's loud. But NextGen wants you to catch what is actually lethal. All right, we're talking the acidosis, the potassium, and the compensatory breathing. All right, those are the numbers that kill, right, are greater than the numbers that scare. All right, does that make sense? All right, drop a 1 in the chat if that makes sense. All right, so that is why A is not included. All right, we're talking about things that are lethal versus things that are generally expected. The answer was B, C, and D if you're just jumping in. All right, fantastic, guys. All right, let's go to question number 2 of this case study. All right, so here we are analyzing the cues in order to determining what is going on with our patient. All right, based on talking through that question 1, this should be pretty obvious. All right, sure. We're talking about DKA. All right, they're type 1 diabetic, there's ketones, there's acidosis, it's DKA. Don't overthink it. All right. All right, so what is the priority hypothesis? All right, so the priority hypothesis, we're talking DKA, which we understand DKA to be acidosis. The answer here is B, right? Metabolic acidosis impairing cellular function because the acidosis shuts down cells. Everything else here is background noise, all right? Everything else is background noise. So we prioritize the hypothesis, okay? So question 4 here. There's 4. All right, which interventions should be initiated first? I hate this thing. Your live is not eligible for recommendation. So I got another violation. I don't understand.
Okay. Just go with it.
All right. Which intervention should be initiated first? All right, this is your generate solutions portion of the case study. All right, what is the thing? All right. All right, so answer here is going to be B. All right, isotonic IV fluids. All right, so I see a few of you put A. Okay, if you give insulin without fluids, things are going to fall apart. The patient will collapse, all right? All right, C, potassium is high initially, all right? We expect that. That'll come down. And then D is reserved for severe refractory acidosis. So fluids before insulin always, all right? Just tattoo it on your soul, okay? Fluids before insulin always. That is why B, okay? All right, guys. If you jumping in, you go ahead and follow. Again, we do these live Sunday, Tuesday, Thursday. This is the first time we've done this form of like case study questions. All right. All right. So let's look at question 5. All right. Which provider order should the nurse question? Which provider order should the nurse question? Does not. All right. So, right. C. Because why? Because in question 1, our potassium was already high. The potassium is already elevated. So, we're not going to give more potassium. All right. The potassium will naturally come down while we do the DK protocol, because what is the DK protocol? We'll do that a little bit. So we start the bolus of isotonic IV fluids, right? We start the insulin drip, and then the insulin drip drives the potassium back into the cells, thereby decreasing the serum potassium circulating through the patient, right? So that potassium is usually high right off the bat. All right, so the level for potassium is 3.5 to 5. 3.5 to 5. So let's jump into question 6 of this case study. All right, so which finding best indicates improvement? All right, again, here we are evaluating outcomes. All right, we are evaluating outcomes. All right, I'm seeing a variety of answers here, A, B, and C. Okay. All right, we're talking about DKA, diabetic ketoacidosis. So the correct answer here is going to be B. All right, the pH improving to 7.32. Okay, so if you fix the acidosis, that is real improvement according to the question being asked. Okay, glucose follows later. Okay, so the pH with respect to everything going on in this question is what is showing and indicating real improvement if we're seeing that move. Okay, good job, guys. All right. All right, this is case study number 3. Here's your clinical information. All right, so we've got some stuff going on here. All right, so select all that apply. Select all that apply. All right, C and B and C, A, B, C, and D, some A, B, and C's. All right, there's a few more answers trickle in. All right, awesome, guys. So I think a lot of you got this. The answer is A, B, C, and D. All right. So, all right. So why not E? Okay, I think E was the one that some of you left out. So oxygen saturation here is currently adequate. It does not address the life-threatening issue. Okay, so in postpartum hemorrhage, circulation fails before oxygenation. So this is a pretty common NCLEX distractor. All right, let's see. And then that boggy uterus, I think that one, the majority of you got that. For A, the blood pressure, hypotension, right? That's pretty significant, requiring immediate attention. C is going to be correct because the tachycardia, right, is a sign of an early compensatory response to that blood loss. All right. D is correct, right, because large clots signal kind of uncontrolled uterine bleeding, okay, and failure of the uterine tone, okay? So that is why D is also included in there. Although I see some of you saying, are clots good things? Well, in this case, large clots signal uncontrolled uterine bleeding. Okay? All right. So that is question 1. Good job. And question 2 here. All right. Which condition best explains the patient's presentation? Which condition best explains the patient's presentation? Okay, I'm seeing A and B, basically. A bunch of A and a bunch of B. Okay, so here the answer is going to be B. All right, uterine. So here I can see some of you, kind of trying to make a case for A, but here retained placental fragments cause bleeding, but the uterus is often firm or only partially boggy, okay, and does not respond as dramatically to massage, okay? So for here, B often does present with soft, boggy uterus and heavy bleeding, right? Especially after prolonged labor. What else? Uterine over distension, if you have like a large baby, oxytocin use. So that is why B is our answer here, okay? Here, all right, so going into the priority hypothesis question here. What is your priority hypothesis that you're evaluating here? Right. So right now we're putting all of these data points together and kind of coming up with, okay, well, what's the main cause of all this stuff? So yes, A, we're talking about acute blood loss causing decreased perfusion. All right. So basically here, I'll tell students here which explanation, if you ignore it, kills the patient the fastest. Okay, that's your priority hypothesis. Blood loss beats pain, infection, and theory every single time. Okay? All right. So, question 4. Which intervention should the nurse perform first? Which intervention should the nurse perform first? All right, you guys are kind of all over the place on this one. I think the majority of you are picking the correct answer here. So the correct answer is B. All right, perform vigorous fundal massage. And okay, now I drill this and I've said it in videos as well. Okay, hands before meds and meds before labs. Okay, if your intervention doesn't stop bleeding, it's not first. Okay, if your intervention doesn't stop bleeding, it's not first. When we're talking about, airway, breathing, circulation, okay, You look at the answer choices that you have in front of you. Which one, in this case, is going to stop bleeding when we understand the problem to be a bleeding problem? Okay? The vigorous 308, okay. But yes, you are going to massage the fundus vigorously. All right, question 5. Here we go. Which order should the nurse implement next? Yeah, on SATs, yeah, I can position the question a little bit higher here. Right, the fundal massage stops bleeding. Okay. Thank you guys for sharing the live. Thank you guys if you're following, if you haven't already. Again, we do these live Sunday, Tuesday, Thursday at 9 p.m. Eastern. All right. Good job. Yeah, I think the majority of you are doing this. So, yeah, answer here is A. All right, next gen loves escalation. Okay, you tried the hands, right? Now you add meds. Okay, anything else is avoidance. Okay, you tried the hands, now you add the meds. Okay, so A is your answer. Okay, what else was anybody putting in here? I was trying to catch some answers as they were popping in, but I think the majority of you were saying A. All right. Isabel's like, that's why I chose C. All right. Now, ambulation here increases bleeding risk and hypotension. So we are not going to do C, and we're not going to do D because manual exploration is a provider level intervention. Okay. All right. So, all right. Good job, guys. Good job. Okay. All right. Question 6. Which finding best indicates improvement? Which finding best indicates improvement? All right, we're putting together all these pieces, okay, because we had bleeding, it was uncontrolled, we had terrible vital signs, had a boggy uterus, then we massaged vigorously, right? We gave some meds. So what indication is going to show that there's been some improvement? All right. Yeah. Answer's A here, right? So instead of a boggy uterus, we want a fundus that is firm at the umbilicus. All right. So here the physiology wins always, right? Okay. A firm fundus tells you that the problem is actually fixed. Okay. So there you go. You had a patient, you had all the clinical data, and you went through your interventions, and now here we are at the end result. Boom, we now have a firm fundus. Patient is improved. Fantastic. Good freaking job. Okay? All right. All right, so Erica, case study. Tomorrow is final. Is this, what's your final on, Erica? All right. Case studies are T, you know. Clock it, girl. You know what I'm saying? I got it. Case studies are T. All right. Here we go. All right. This one's a shorter intro here. Med-surg final tomorrow. All right. Good luck, guys. Good luck. Case studies are common. You might see them set up a little differently, but the thinking that I'm trying to get you guys to go through when you answer these questions is kind of what we're learning today. all right, is what each question is asking. So question 1 in a case study is seeing if you can recognize cues. Okay, that's the clinical judgment skill we're trying to identify with question 1. All right, there's 6 clinical judgment skills within next-gen case studies. All right, so question 1 always assesses if you can recognize cues. Okay, all right, so let's talk about our baby here. So 3-year-old with RSV bronchiolitis, they've got some breathing stuff going on, lethargic and no longer crying. All right, the correct answers here are A, C, and D. Okay, so I think everybody got A. So all right, B is incorrect because tachypnea is an early compensatory finding in RSV. All right, it's not as concerning as fatigue. Okay, it's not E because the saturation of 90% is abnormal, but still compensatory, right? Okay, neurologic fatigue is a later and more dangerous sign. So that lethargy, the intercostal retractions, and no longer crying are the cues that we should recognize. Okay? All right. So numbers can lie, behavior tells the truth. All right? A quiet, lethargic child is sicker than a crying, tachypnic child. All right? So NextGen wants you to recognize decompensation, okay? Not just abnormal vital signs, okay? All right. If that hit you in your soul, you got to share the live now, okay? All right. All right, here we go. Question number 2. Which interpretation best explains the child's change in status? So question 2 of every next-gen case study is seeing if you can now analyze the cues. So you've recognized them. We know the cues are lethargy, retractions, and no longer crying. Well, now can you analyze them? Okay? And give this, and bring some understanding to the issue here. All right. So what is happening, right? B is happening. So respiratory muscle fatigue is occurring. Okay. So when retractions disappear because the kid's tired, that's like pre-arrest behavior. Okay. They're basically auditioning for a code. All right. So the next gen test whether you mistake fatigue for improvement. That's what they want to see here. All right. Did you mistake fatigue for improvement? Okay. All right. So respiratory muscle fatigue is occurring. All right. That is you analyzing all the cues and putting that together. All right, Erica, thank you for sharing and liking the live. I greatly appreciate that. All right, so next, question 3 is what? Looking at the prioritized hypotheses. All right, so let's jump into question 3. All right, what is the priority hypothesis for this little baby? It is a baby, right? 3-year-old. All right, toddler. All right. Right, this one should be pretty straightforward. So, impaired gas exchange. All right, NextGen doesn't care what virus it is. Okay, it cares whether the child can oxygenate. All right, airway and breathing always outrank labels. All right. Boom. Good job. Here we go. Which intervention is the priority? Which intervention is the priority? Again, this should be, I feel, Pretty obvious. Okay, don't let me down. Don't let me down. Has anybody else been watching this NCAA volleyball tournament? Holy moly. Not to get off sidetrack, but this Nebraska game was crazy. I've been getting into it. Holy moly. My daughter plays travel volleyball, so we watch it together. Anyway, yeah. Michigan kicked butt. Yeah, Texas and Wisconsin's on right now. All right. So, which intervention is the priority for our baby? Right. A, supplemental oxygen. All right. Come on now. All right. So when I teach this, right, so when oxygen is the problem, oxygen is the answer, right? Okay. So next gen is going to reward interventions that immediately change the physiology, okay? Not supportive care that sounds helpful. Does that make sense? All right. Next gen rewards interventions that immediately change physiology, not supportive ones that sound helpful. We are doing a total of 6 case studies. I think this is number 4. Okay. So yes, boom. When oxygen's the problem, oxygen's the answer. Eric is like, I'm caffeinated and ready. Let's fucking go, guys. Let's go. All right. Question 5. Here we go. All right. What provider order should the nurse question? All right. Are you guys laughing at me right now? I don't even have scotch tonight. All right. All right, Venus, that's all right. I want you guys to enjoy these and not just be like a talking bubblehead. All right. I did. I said it. Zandria, yep. You saw that no scotch. That's right. Can't be drinking scotch every night I go live. That's a problem. Okay. Just some good old H2O. All right. So, right. Answer here is C. Okay. The sedative for agitation. Why would we? No, that's not a good idea. Okay. You never sedate somebody in respiratory distress ever. Okay. If a drug can stop breathing, it has no place here. All right. It has no place here. So if you're answering A, I feel like you maybe misread the question. So what should we question about this? It is the sedative for agitation. Okay, C. Sedative for agitation. All right. Well, I'm glad you guys have your beverages of choice. Fantastic. All right. Eric is caffeinated. All right. Godiva's got her wine cooler. All right. What else? Anybody else have anything fun that they're drinking on tonight? All right. And then, so that question 5, that was the one. Let me just go back real quick. Question 5 in the case study is asking you to take action. That's the take action portion of the case study. All right. So we went to from generate solutions previously to take action. And now we are going to evaluate outcomes. All right. Oh, Venus, that's no good, girl. Knock that shit out. Don't do that. All right. So which finding best indicates improvement? Which finding best indicates improvement? Amber, the scotch I drink is Balvenie. It's usually a 12-year-old Balvenie. I think that's how you say it. All right, hold on. Who said that? Let's see. Avery said, graduated nursing school yesterday, having a glass of wine tonight. You deserve it. Good job, Avery. All right. If you're give Avery a W in the chat. She graduated nursing school yesterday. That's awesome. Congratulations. That's the hardest part. That is the hardest part. Lots of love for Avery in the chat. Good job. And Megan also graduated yesterday. Awesome. You guys are freaking awesome. All right, now let's get past this next hurdle and get you guys your freaking license, right? All right, so here, evaluating outcomes. The answer is D, okay? So we see that SPO2 improve. So outcomes, listen, when you're on this last question, the sixth question of a case study, okay, evaluate outcomes. The outcome must match the problem you treated. Okay? So we treated oxygenation, so oxygenation must improve. Okay? Good. Got this. Okay. So that was that one, right? Okay. So this, I believe, is case study number 5. Yep. Okay. All right. Here we go. Which findings, select all that apply, require immediate attention? All right, so here, again, what's the clinical judgment skill of question 1 of a case study? Recognize cues. All right, recognize the cues. All right, if you guys are new here, just jumping in, we do these lives every Sunday, Tuesday, Thursday at 9 p.m. Eastern. You can go ahead and follow here. All right. And on my profile page, there's a bell in the top right, actually, that if you click the bell and then select like live notifications, you'll be notified every time I go live. Okay. So, all right. So question 1. The answer is A, B, and D. All right, so sudden unilateral weakness, slurred speech, and irregular heart rhythm. Okay, those are the 3 cues that we are to recognize here. All right, so with C, elevated BP is common and often expected in an acute stroke. All right, it's their body trying to maintain cerebral perfusion. All right, it is not the most urgent finding unless extremely high or accompanied by other complications. Okay, so the reason E is wrong is because a normal glucose rules out hypoglycemia because that can often mimic a stroke itself and is reversible. Okay, so generally what I say here is like we have sudden and focal. That is going to equal a stroke until proven otherwise. So weakness, slurred speech, and AFib are the real clues. The high BP, normal glucose is just background noise. All right, you cannot let them steal your attention here. All right, so those are the cues we're recognizing. All right, now every time we see question 2, we need to analyze those cues. So which condition is most likely causing the patient's symptoms? All right. Okay. Yeah. All right. You guys are jumping all over this one. Of course, it's B, right? So if the glucose is normal and the deficits are still there, stop blaming sugar, right? So risk factors plus persistent deficits is an ischemic stroke. Okay. How to tell the difference between hemorrhagic and ischemic? Your CT will tell you that. All right. Your non-contrast CT, which is the first, after you basically check a blood sugar, you go straight to CT, and that CT will show you if it's a hemorrhagic, if there's obvious bleeding on the brain. Okay. All right. So good job. We have now analyzed the cues, and we will go into prioritize hypotheses. Okay. What is the priority hypothesis? All right. Yeah, this one's obvious, right? So we're talking like this whole event is pointing to A, the cerebral ischemia. All right. So next gen wants the, what kills neurons fastest answer. All right. So high BP won't kill brain cells in minutes. Okay. Ischemia will. Okay. So that is why our answer here is A. All right. So which action should occur first? Which action should occur first? Of these four things, which thing should occur first? All right. Yeah, we kind of talked about this, right? We want to get that non-contrast CT to identify, is it in fact an ischemic stroke or a hemorrhagic stroke? All right. So thrombolytics and antiplatelets are contraindicated in hemorrhage. So imaging must occur first in order to guide safe treatment. All right. So, yeah. If there's no CT scan, there's no clot buster. Okay. The NCLEX, the next gen loves that rule. All right. So if you skip the CT, you fail. Full stop. All right. You need that CT. You need to know exactly. You need to know what you're treating. All right. All right. Question 5. So question 5 of the case study asks you to take action. All right. No, we did not already get the CT. We just kind of talked about it. All right. So which provider order should the nurse question? Swallow valve. Yeah. So the answer here, you all are getting it spot on, is C. Okay. Administer that oral antihypertensive. So giving anything to lower the blood pressure could worsen the cerebral ischemia. Okay. A lot of times when a patient presents with a stroke or stroke symptoms, until proven otherwise, we allow what's called permissive hypertension. So we allow patients to usually have a blood pressure that could, usually the limit is, 220 systolic is the limit that I typically see. So we'll allow them to have a blood pressure up to 220 systolic because that's their body trying to compensate and have adequate perfusion. Okay. So we don't want to take that drive away from the patient, right? Okay. So now question 6, which finding best indicates improvement? So your answer here has to point to the problem that you tried to solve. So what was the problem you tried to solve? All right. Excuse me. Kind of getting over a little cold here. All right. Now, for those of you saying, "Hey, the blood pressure, did we treat the blood pressure?" If you didn't do anything to treat that, then that can't be your answer. Okay? Again, what you pick in this last answer of the case study has to be something you addressed. Okay? Generally. Maybe in this scenario, we didn't per se take a specific action. We didn't give them any medication or anything like that, but the overall problem of the ischemic stroke, that is the main takeaway here for this patient. The one answer that shows and indicates improvement is going to be B. Okay? Speech becomes clearer, grip strength improves. Okay? So stroke outcomes are functional. All right? Talk, move, grip. All right? That's how you know you helped. Okay? All right, good job. Let's jump into this last case study here. All right, charge nurse is managing a busy medical unit with limited staff. The unit includes a mix of post-op patients, new admissions, and stable long-term patients. All right, if you guys are still just hanging out and have not already followed, I would highly encourage you guys, to follow. We do these lives every Sunday, Tuesday, Thursday at 9 p.m. There is also a full 34-part NCLEX review playlist on my page. And if you're interested, I also do custom NCLEX study plans, which you can find in the link in my bio on the main part of my page. Okay? All right. So, question number 1. All right. I think a lot of you are getting it. It is A, C, and D. All right. So, we're talking about unstable, unsafe, or deteriorating. That is for the RN now. Okay. Everything else can wait. So, it's not B, right? Pain meds can be delegated or delayed briefly. And E, teaching can be rescheduled, okay? So A, C, and D are the cues that we are going to recognize. All right? Good job. Question 2, what principle best guides the nurse's prioritization? Yeah. All right. This should be pretty straightforward. So this is Maslow's hierarchy of needs. So for this question, right, Maslow isn't theory here, okay? It is survival logic. So it is also the only answer that makes sense. All right. You're not doing nursing actions based on patient satisfaction or staffing, all right, or first come, first serve. It doesn't make any sense. Yeah, right. First come, first serve in my book. Anyway, so we're not going to do that. We can talk about it. We can make fun of it, but we're not going to do that in real practice. We're not going to do that on the NCLEX, right? So, all right, Magnet, thanks for the follow. Appreciate it. All right, so that was question 2. We have now analyzed the clinical judgment skill for this one. We analyzed the clues. All right, and now for question 3, we are going to prioritize hypotheses. What is the priority hypothesis? What is it? All right. Right. Absolutely. Patient safety risk, right? So the problem isn't time, it's danger, right? So when we're talking about, so here in a question, like multiple patients are at risk for harm, okay, if not addressed immediately. That's why patient safety risk is the answer. The rest, they describe causes, all right, not the threat. So that one's pretty straightforward. And then question 4 of the case study, which task can be safely delegated to a UAP? All right. Does everybody know what a UAP stands for? Yeah. Okay. So B, right? Because vital signs on a stable patient are routine data collection. Right. Godiva says unlicensed assistive personnel. Those are your CNAs on the floor, right? So question 4 is asking us to generate solutions. Okay. So the solution we have generated is to delegate a task to a UAP on a stable patient. All right. A, C, and D require RN judgment or teaching. All right. So those are all things that the RN has to do. All right. So which action should the RN take first? So this question is about taking action. Okay. Yeah. Right. You're going to assess the patient with chest pain because that is your job as a nurse. All right. You're not going to, you need to take care of any potentially life-threatening conditions. Okay. Those are always going to take the precedence. The others, so A, C, and D, they delay assessment of the unstable patient. Okay. So that's the one where we are going to take action. Okay. Because you don't chart emergencies, you assess them. All right. And then which outcome best indicates effective leadership? Right. Again, so these questions, I feel more so, yeah, they're easy. But what I guess I wanted to help convey to you guys is that case studies in and of themselves aren't something to be feared. Okay? If you understand what these case studies are trying to get at with each of these questions, whether they want you to recognize the cues, analyze the cues, right? Prioritize hypotheses, generate solutions, take action, evaluate outcomes, all right? Those are the things that each of those 6 questions of the case study in the next-gen format wants you to identify, all right? So do your answers fully line up? Is the question about this one about evaluating outcomes, does it actually evaluate something you addressed? Because the outcome has to be something you addressed previously. All right. So I see the comments. Oh my God, Jimmy, these are so easy. I get it. All right. This is more so, I feel some were more challenging than others, but understanding how to attack these case study questions and understand what they want. Yes, clearly here the answer is B. All right. No patient safety events occurred. All right. If you didn't get B, because we're talking this whole question is about safety, right? It is all about safety. Everything we've done up until this point was about being a safe nurse, about delegation, leadership. Okay. So those are the actions. Those are the cues that we saw. We analyzed the cues. We took action with respect to patient safety. So the outcome that we have to settle on here has to be related to patient safety. Okay? All right. So, boom. 6 case studies. All right. Breaking it down with the next gen mindset of what each question is asking. Hopefully that. So in my NCLEX vault, okay, that's that free resource via the link in my bio. There's a whole strategy guide as well that tells you how to break down each type of NCLEX question, not just case studies, but SATAs, bow ties, all right, your regular run-of-the-mill NCLEX question. So that's all there for you to look at free, okay? So if you need reinforcement on what we just went through and how these case studies are laid out, check that out. All right, Kit, thank you. Yep, I appreciate those kind words. Thank you so much. If you guys haven't already followed, you can follow up there. Again, we do these Sunday, Tuesday, Thursday at 9 p.m. Eastern. All right. Yeah, case studies definitely remind you of writing care plans, right? You have a problem, you have data, right? You identify problems, you put in your nursing diagnosis, like what you think is going on, and then what outcomes do you expect to see or predict? Yeah. Basically, yeah, that's a good thing. You know, case studies are kind of like care plans in question format. So absolutely. Godiva wants to do some pharmacology on Tuesday. Yep, Sunday, Tuesday, Thursday at 9 p.m. Eastern. Awesome. Thanks, Amber. Thoroughly enjoyed the session. How can I review these again? You can review these again by going to the link in my bio and going down to the NCLEX vault. And in the vault, there's a section specifically on strategy. And it breaks down how to answer each type of next-gen question. All right. I know this has been a topic that people have been wanting to see, and I've been trying to figure out the best way to do it. I'm still not sure this was the best way, but I feel like it got the job done. Mental health and respiratory. Can we do mix on Tuesday? Definitely pharm, but other stuff too. I take NCLEX on Wednesday. All right, Megan. Hell yeah. So Chul's like, this is good. Clock that shit. I've been an ER nurse since 2022. So again, this was a 4th career for me. I started nursing school at 33 years old. And, I have a whole video on that. Started at 33. I worked full-time as a CNA all through nursing school. It was tough. It was a grind, but I know a lot of you are in that same position, and trust me, it can be done. All right. So good luck, Tamara. Yeah, definitely update us. Come back Tuesday. Drop in. Say hello. All right. And again, if you guys are looking for, if your test date is more than 2 weeks away and you want help just putting all of your resources together and taking the guesswork out of studying for the NCLEX, I will create you a custom study plan and tell you what to study Sunday to Saturday in blocks based on your weaknesses. All right. You can do that. The link's in my bio to get your custom NCLEX study plan. I'm happy to do that. All right. You work 2 full-time jobs and 32 on the hell. My God. All right, man. Good on you. It can be done. All right. It can be done. All right, it is 10:05, so I'm going to respect your time as well. I told you an hour, so we'll get out of here. All right, take care. We'll see you Tuesday, guys. All right. Amber says the study plan's so freaking worth it. It's amazing. Thank you so much. All right, so take it easy, guys. We'll see you Tuesday, and I'll have some videos in between now and then.